Hello everyone, welcome to another episode of Dr. Tade Talks. I am Dr. Tade, and today we will continue our talk on autism spectrum disorder, which I also refer to as ASD. In the first part of our talk on autism, we discussed the signs and symptoms. If you missed it, I want to encourage you to go back and watch it. Today, we will be discussing the causes and the risk factors of autism. We will also go through the screening process for autism. So what causes autism? While scientists do not know the exact cause of autism, research suggests that genes play a role in ASD. And this, combined with environmental influences, can affect the development of a child. Even though it is still a mystery why some people develop autism and others don't, some of the risk factors include having a sibling with autism, having parents who are advanced in age, having certain genetic conditions. For example, people with conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome are more likely than others to have autism. Also, being born with very low birth weight may make a child prone to autism. How do we diagnose autism? Doctors diagnose autism by looking at a child's behavior and development. ASD can usually be reliably diagnosed by the age of 2. It is important for those with concerns to seek out assessment as soon as possible so that a diagnosis can be made and treatment can begin immediately. Diagnosing autism in young children is often a 2-step process. The first stage is the general developmental screening that occurs during well-child visits. Every child should have well-child visits with a pediatrician or an early childhood healthcare professional. The American Academy of Pediatrics recommends that all children be screened for developmental delays at their 9, 18, 24, or 30-month well-child visit. Specifically, children should be screened for autism at their 18 and 24-month well-child visit. For example, my attention was drawn to my son's autism when we took him for his 18-month checkup. The experiences of a parent and their concerns are very important in stage 1 of the screening process. Sometimes the doctors will ask you questions about your child's behavior. They will combine these answers with information from the autism screening tools. And they will also look at the child's behavior. They will observe the child's behavior. And children who show developmental problems during the screening process will then be referred to a second stage of evaluation. So what is the second stage of this evaluation? This second evaluation is usually with a team of doctors and other health professionals who are experienced in diagnosing autism. Remember, you cannot just look at a child and conclude that they have autism. You have to take them to a professional. This team may include a developmental pediatrician who is a doctor that is specialized in child development. It could also include a child psychologist or a child psychiatrist. These are doctors who have specialized training in brain development and behavior. Another team member may be a neuropsychologist, a doctor who focuses on evaluating, diagnosing, and treating neurological and neurodevelopmental disorders. A speech-language pathologist may also be helpful. This is a health professional who has special training in communication disorders. The evaluation may assess cognitive level or thinking skills. So they'll look at how your child is thinking, how high their cognitive level is. They could assess their intelligence. Another assessment could be language abilities. For example, if your child is not talking, they will assess their language abilities. They would also look at age-appropriate skills that are needed to complete daily activities independently, such as eating, dressing, toileting. So they'll look and see if the child is hitting those milestones. Is the child able to feed themselves? Are they able to dress themselves? Are they fully potty trained at a certain age? So because autism is a complex disorder that sometimes occurs along with other illnesses or learning disorders. The comprehensive evaluation may include blood tests and hearing tests. The blood test may be uncomfortable for your child, so I advise parents to be ready for that experience. Some children with autism have a difficult time having people touch them, so it may be hard for them to sit still to have blood drawn from them. Autism can only be diagnosed by a medical professional. If you have concerns about your child or any child you know, it's important to seek the help of any of the professionals that I mentioned earlier for proper diagnosis and treatment. Like I always say, early intervention is the key. If you have any questions or comments on today's topic or any of the topics we have talked about, please feel free to comment below or message us privately on any of our other social media pages. You can find us on Facebook, Instagram, and Twitter. Don't forget to subscribe to our channel and please share with your community to help us create awareness on mental health issues within our larger community. Thank you so much for watching. Remember, fear, shame, and anxiety are not who we are or who we were created to be. See you all next time.